Hi folks, John Zajeros here from UltimateBadBackStrategies.com, thebadbackguy.net, and a few others. I had quite a few questions regarding what I had talked about with the spinal curvatures, and particularly what it had to do with degenerative disc disease and also the breakdown of the spine itself and how that related to neck pain, back pain, and sciatica. So I thought I would go into a little bit more detail. We're looking at the lumbar spine here. This right here is L5, 4, 3, 2, 1, and then this is the 12th thoracic vertebra, and here's your sacrum down here. This is the first sacral vertebra, and you remember that's a primary curvature. This is a secondary curvature, and then the thoracic begins another primary curvature. This curvature started and was formed after we started to get up and walk on two legs. The degenerative disc disease is not a disease, and that's the question that I've come across quite a few times over the years, but in particular with respect to the previous few videos that I did. So what happens is a combination of factors that work in concert and actually work against the spine, and particularly against the discs. Now you can see examples of a degenerative disc here, or a degenerated disc. A bulging disc, what they call a herniated disc, and if you remember, that's where that jelly donut inside, the nucleus pulposus, actually breaks through this outer ring, this annulus fibrosus, this cartilaginous structure that holds that jelly in. So in a herniated or ruptured disc, you get this blowout. A bulge here is where the jelly itself just kind of pushes on the edge of the disc and causes this area here, this opening. It's called a foramen, but it's an opening, and what is usually coming through most of these foramen are nerve endings, and when you start to see pressure like this, you start to see an awful lot of pain. But getting back to the degenerative disc, if you remember, I talked about the 5 factors that contribute to neck pain, back pain, and sciatica. And if you remember those 5 factors, they are excess or weight or obesity, muscle weakness, muscle imbalance. The 4th is a combination of nutrition and diet, because those are intricately linked, however they are not the same. And 5 is hydration, or rather inadequate hydration, dehydration. The fact is that these discs are predominantly water. And if we are like most people, if you're like most people, like me and everyone else, we drink a whole lot of Diet Coke or Diet Pepsi or Diet Pop. We drink a lot of coffee, a lot of tea. Some of us drink alcohol. And all of those things work against taking in adequate amounts of water and replenishing the water that our body uses. And consequently, we end up with this sort of a situation here. So we've got excess weight creating an exaggerated curvature, primarily in the secondary curvatures of the cervical and the lumbar region, the neck and the lower back. We also start to see, along with those pronounced curvatures, we also start to see weaknesses in the muscles, and remember the transfer of the stress from the muscles to the IVDs and then to the bones themselves. In addition to that, we see muscle imbalances that are created as a result of all of this working in concert. Finally, inadequate nutrition is just absolutely key to our bodies being able to rebuild themselves as a result of our stressing them on a daily basis, and particularly the spine. So I hope that helps you to understand a little bit more about degenerative disc disease and neck pain, back pain, and sciatica.